let's talk about the supplements. There's lots of thyroid support supplements out there, like Lowe's, and a lot of them are really, really, really good. I'm not going to talk about brands because, well, number one, my licensing body doesn't allow that. Number two, that's not fair. There's a lot of great, great supplements out there. Now, the thing about thyroid supplements, if it says thyroid on the label, I find that to be a formula that has good preventative maintenance potential to it. Meaning that if you're undergoing, you're going through a lot of stress, you're just finishing school, you've been at this for a really long time, you're starting to find symptoms that you might be low thyroid, but your TSH is okay, that's a good supplement to be on. It's a preventative maintenance, okay? For those of you who have a thyroid condition, I find that you're kind of beyond that. So it might help a little bit, might help you feel better a little bit, but I find that there's a lot more technical. You have to get more technical with the supplements in order to actually make a difference if there's already a thyroid dysfunction going on. Meaning, if your TSH is up above like 4, or even if it's like 3.5, and you're getting symptoms, then I'm like, well, maybe just like if you feel like taking that supplement, it's not going to hurt you, but let's look at some things that might be more effective. And then I actually look at what it is that you as an individual need. I talked in a previous video about tooth demineralization. So your teeth get like demineralized and they get kind of translucent. Same with the nails, the skin around the eyes, those types of things. But I'm also going to be looking at what your history is, whether or not you had chemical exposure, whether or not you've had a stressful situation in life that you just went through for a 1.5 years, whether or not you have been eating okay. Maybe you've been dealing with stress eating. Maybe you haven't been able to digest those healthier foods and you've been going towards your rice and your cake and your potatoes and your carbs because that's the only thing that will go down. You've had digestive issues, or you've had a relapse of Crohn's or something, and now you kind of have that low mineral or low vitamin state. Maybe I dose you that way. Or maybe what we look at is actually detox. Maybe we look at detox. Maybe we look at the rest of the endocrine system. Maybe there's a female hormone deficiency. Or maybe there's an inability to get rid of the estrogens properly, and that's affecting the rest of the endocrine system. Or maybe you have low testosterone, male or female. Low testosterone can be a contributor to low thyroid function. The endocrine system it's all connected, right? Maybe you started shift work 3 years ago and you just don't feel the same. Maybe it's a circadian rhythm problem. Maybe you have a reversed cortisol curve. Reversed cortisol curve. That's a big one. I always am looking for a reverse cortisol curve. It's part of the endocrine system. It's part of the adrenals, part of the stress state. And what a reverse cortisol curve is that your cortisol is supposed to be high sometimes in the day. It's actually what helps us perform. If I didn't have any cortisol today, I wouldn't have the energy to be doing these videos, and I certainly wouldn't have the face for it. I'd look tired and haggard. I wouldn't want to be on video. So luckily, I have good cortisol today. My performance hormone wants to be highest shortly before we get up. And so I say 8 a.m., but that's just when you have a typical office job, right? Let's say you're on a shift job. Fine. You have a regular shift, your cortisol should be at its highest a few hours after you wake up. Should be at its lowest right before bed. Or I guess like while you're sleeping. However, with a reverse cortisol curve, it'll be too low when you get up. And then over time, before you go to bed, it actually, it spikes. It goes up. It's supposed to be high when you get up, not when you're going to bed. That's a reverse cortisol curve. And so you'll be tired all day, just dragging yourself around. And you get home and you get a second wind and you can't sleep. Very, very, very frustrating situation, reverse cortisol curves. And so with a thyroid dysfunction, if I start to see early signs or even late signs of thyroid dysfunction, you've had it for a while, I'm always looking. Do you have a reverse cortisol curve? And if you do, let's flip it back to the way it's supposed to be. I can pretty much guarantee you'll feel better. And thyroid function is most likely going to be a lot more functional. So let's talk about iodine, because some of you are familiar with iodine, the mineral iodine, the essential mineral. I'm not. Okay, let's talk about it. So you'll see, and especially a lot of health magazines, they talk about iodine. It's wonderful. It's wonderful medicine. It's a medicine that I have a high degree of respect for, and that should tell you that I use it a lot, but also that I don't mess around with it. I don't take it for granted. I respect it, because if I don't, it can cause problems. Okay? It's one of those. Kind of like iron and vitamin D. You got to respect those medicines, those nutrients. They're powerful. So, You don't want to just start taking iodine. You want to talk to your doctor. Well, your naturopath. Maybe your nurse practitioner. I can't guarantee that your medical doctor will know this stuff. It's not necessarily part of their training unless they've taken extra courses on it, in which case, wonderful. And by the way, a medical doctor is a great thing to have on your team. So don't sort of discount that just because you're not getting everything you need from your medical doctor. They're a very, very important part of your team. But they shouldn't be the entire thing, in my opinion. Especially when it comes to these complex thyroid conditions with reverse cortisol curves and low testosterone and mineral deficiencies and all that sort of thing. Because when it comes to iodine, it's not what you pick up at the pharmacy that you put on your skin, okay? So don't just go to the pharmacy and get an iodine liquid and take it, okay? Unless somebody has told you that that's okay and that they're monitoring you. And even then, it has to be a very, very specific kind, okay? Not the regular stuff that you'd normally find in the pharmacy. So that stuff's for cuts, and it's really good as an anti-infection agent now. But when it comes to taking iodine, there's a number of ones that you take, but you want to make sure that you don't have other nutrient deficiencies while you're taking it, because if you're in a deficient state in another mineral, the iodine can actually backfire and cause a hyperthyroid state. Okay, so that's what I want to say, that I want you to remember most about iodine, and why I respect it so much is that if we are deficient in another mineral, the iodine could in fact backfire. The iodine therapy could backfire, okay? And we're reading dosing in a book about iodine. Bear in mind that there's different forms of iodine, and so if you're reading about iodine in some book and it says take, this dosage is the best, you need to make sure that that is the same form, that they're referring to the same form of iodine that you're purchasing, because there's different forms of it, and so there's going to be different dosages according to the different forms, okay? Now, the most common medical, like prescription grade, but it's not prescription, it's like pharmaceutical grade natural health product that a naturopath would use, iodine, that would be called potassium iodide. And so that's the one that you see the most medical literature about, and that's the one I started with when I started doing iodine therapy, which I did not just start go and do. Like, you take extra courses, you learn about it, you learn the risks, you learn the benefits, you learn when it's appropriate and not appropriate, and you learn what a specialist is doing as well, because it's important that the specialist and the iodine therapy are both in alignment. Potassium iodide. Now, what else is in that then? It's iodine on a potassium. So, if you have a low adrenal problem, if you have kidney dysfunction, if you have a cardiovascular problem, if you have certain cardiovascular medications, all of a sudden, you start taking a supplement that you buy at the store. It's got a whole bunch of potassium in it. That could cause a side effect to a medication you're on or to a health condition you have. See? Told you. There's also kelp. I love kelp. And actually now health food stores are coming out with brands of health products are coming out with a good solid dose of a kelp that actually is therapeutic. That is something that I can use, not for preventative maintenance, but actually for treatment, which is wonderful. So that's iodine. So I really wanted to just talk about that. There's lots of other thyroid supplements out there that are very helpful in certain states. Sometimes I'll recommend ashwagandha. Sometimes I'll recommend, like I mentioned in another video, lemon balm and rosemary. Sometimes I'll recommend Shazandra, or maybe I'll recommend a female hormone protocol. Maybe I'll recommend a liver detox. There's lots of herbs, right? Google, you'll see the Guggul, Commiphora. That's myrrh. Myrrh is so, but these are things that, again, respect the medicine. Respect the medicine, respect the medicine, okay? Because I do. I think that's important. Okay, have a great day. Happy supplementing.